40% of men struggle with lasting as long as they'd like in the bedroom at some point in their lives. That's right, nearly half. I'm Dr. Riva, lab urologist and pelvic surgeon, and today we're talking about how to last longer in bed, what causes premature ejaculation, who it affects, and most importantly, what can help you improve your sexual stamina and control. Really quickly, if you guys have been enjoying my channel, check out my newsletter. You are going to love it. Every week, I send an article review for both men and women, as well as answer a newsletter subscriber question and let you know what I'm up to. So it is so fun, super easy read, and a great way to stay in touch with me. So check it out at newsletter.rinamalikemd.com. Can't wait to see you there. All right, what is premature ejaculation? So what exactly is premature ejaculation? Simply put, it's when ejaculation happens sooner than you or your partner would prefer during sexual activity. In other words, you're just not lasting as long as you want in bed, and it's causing distress. Now, the clinical definition is ejaculation that occurs either within 1 minute if it's been lifelong or within 3 minutes if it's new from the beginning of penetrative intercourse. Now, this isn't mental health impact of PE just about how long you last. It is about how this affects your mental health. Men with premature ejaculation struggle with issues with self-esteem, anxiety, feelings of decreased self-worth, and it can be very, very demoralizing. In fact, in a previous video, I shared how personality might be linked with premature ejaculation. So if you're curious about that, check the video out. Now let's talk about what actually causes it to be difficult to physical, psychological, and emotional causes last long in bed. And it can be due to physical, psychological, or emotional factors. And oftentimes it's a combination. So let's start with the physical causes. These can include testosterone. So abnormalities in testosterone are linked with ejaculatory dysfunction, and so we should always get your testosterone checked if you're struggling. Now, sometimes treating testosterone doesn't always fix the issue, but sometimes it does. It can also be due to having heightened sensitivity in the area of the glans or the frenulum of the penis, which is essentially the connection between the glans and the foreskin. And this can lead to quicker arousal and ejaculation. Now, on the psychological and emotional side, it can be related to things like stress, work-related, financial, personal stress, anxiety about sexual performance. And this is a big one, right? The first time you have a problem in bed, you are thinking about it the next time you have sex and the time after that. And so it becomes this self-perpetuating cycle which worsens anxiety and makes things worse. Depression, of course, can affect both mood and physical function and relationship issues. If you're having relationship issues or communication problems with your partner, you can have a lot of issues in the bedroom. So what can you do about it and what actually works? Now, there are several evidence-based approaches, some of which require medications and others don't. And the right one really depends on what's going on with you. So let's break down the main treatment options that can help you. First off, let's behavioral techniques that actually work start with behavioral techniques. And these are often the first line of treatment, and they can be highly effective. But you do need to be on board with it either by yourself or with your partner. Now, the first technique is called the stop-start method. So this is where you pause stimulation when you get very close to ejaculation, and then you start again and do that 3 times, and on the 4th time, you allow yourself to ejaculate. You can also incorporate the squeeze technique, which means you apply pressure at the head of the penis when you get to that point to reduce the arousal as well. Now, these techniques can be very helpful, but you realize that if you're with a partner, it can lead to frustration. So they need to be completely on board. And 2, you can also practice these on your own during solo sex because it can help you sort of figure it out on your own time. Pelvic floor exercises and common mistakes. Next up is pelvic floor exercises. Now, pelvic floor exercises can be helpful, Oftentimes, you will hear people talking about Kuel, and they might help you have better control over when you ejaculate. However, it's important to understand the state of your pelvic floor to begin with. A lot of guys with premature ejaculation often have high tone pelvic floor, and what that means is that when you do Kegel exercises, you're actually going to make it worse. So you can check out my video with physical therapist Eric Lakey, where we talk about exercises to relax the pelvic floor to help you last longer in bed. Now, a couple other things which have a little bit of data on them, but they are really low risk. Breathing, hidden body awareness. One is diaphragmatic breathing. So doing diaphragmatic breathing exercises. So taking big, deep breaths into the belly have been shown to enhance your time to ejaculation by 900%. Let me say that again. Doing breathing exercises can help you last longer by 900%. I made a whole video about this research behind this, so check it out because I think it's so useful. The other thing is high-intensity interval training. So high-intensity interval training allows you to get really good at understanding where your body is in space and also understanding your internal sort of perception of your body. And so it helps you then take that information and use it when you're in the bedroom. And in one study, they looked at this and they did high-intensity interval training for 7 minutes a day. And after 2 weeks, they saw an improvement in time to ejaculation. Now, if you remember, I mentioned earlier, this is often because there's heightened sensitivity of the glands or the frenulum, which leads to finishing delay creams, sprays, and sensitivity control too quickly. What can you do about that? There are over-the-counter and prescription creams and delay sprays, which help reduce the sensation or desensitize the area to allow you to last longer. These are typically containing lidocaine or prilone, and they do work quite effectively. Depending on the formulation, they're usually applied 10 to 15 minutes before sexual activity, and you gotta figure out the right amount for you. If you use too much, it might reduce your sensation, and you might notice that you start having erectile dysfunction. And if you don't wash it off, it can sort of transfer to your partner and cause them to have decreased sensation. However, once you figure it out, they work oral medications and medical treatments very well. On to oral medications. Now, oral medications are all off-label. There is no on-label medication yet for premature ejaculation. So we're basically using medications that are used for some other purpose and have a side effect of increasing time to ejaculation. First up is SSRIs, or selective serotonin reuptake inhibitors. And these are typically used for depression, but they have a side effect of delaying ejaculation. And obviously, this can be helpful in guys with premature ejaculation. You do need to take them every single day. And there's multiple different types available, so talk to your doctor about figuring out the right dose and the right medication for you. Duloxetine is a specific SSRI that you can use on demand, meaning that the days you want to have sex, you can take this pill and it will help you last longer. However, it is not available in the United States, and so you can get it from other countries. And if you're not in the US, maybe that's a good option for you. There is also a new medication that's currently under study for premature ejaculation, which I'm really excited about, and as soon as I see more clinical data, I will be happily updating you guys on the information. If the antidepressant medications don't work, there are some additional options which have shown some efficacy. Things like alpha blockers like silidocin or a medication called tramadol has been shown to improve time to ejaculation. However, again, you want to talk to your doctor about these because there are side effects. Now, there is one special erectile dysfunction, therapy and long-term success case. If you are struggling with erectile dysfunction and premature erecting, oftentimes they go hand in hand because you can imagine that if you're worried about lasting long enough because your erection is going to go away, you will start trying to rush through sex, which then sort of trains your body to then premature ejaculate, which is essentially not ideal. So when you treat the erectile dysfunction, oftentimes the premature ejaculation gets better. So in these cases, I really like to offer medications like sildenafil or tadalafil to help improve erectile function. Now, guys, I mentioned, of course, that this is not just a physical issue. This is very often a psychological issue. And so, in this case, getting a specialized counselor sex therapist can be really, really helpful to working through your thoughts and anxiety around sex. And sometimes the most effective treatment is doing both psychological care as well as physiologic care, meaning that you're seeing a sex therapist and you're doing the exercises and you're taking medication. The most important thing is consistency. It is not just a one and done thing. You're not just going to get better right away. Whatever approach you decide to go forward with, give it time to work. Most of these approaches require several weeks to even months of consistent practice before you see significant improvement. All right, guys, I hope you found this helpful. If you did, do me a solid favor. It is free, takes just a couple seconds. Hit that subscribe button. It is so helpful. And as always, you want to take care of yourself because you are worth